Hey guys, thanks for checking this video out. We're just going to go over a few very important things that you can do for back pain if you're ever having to deal with that. This can be acute back pain that comes on with the workout, specific movement, say you hurt your back doing a squat or deadlift, something like that. Or this also could be back pain that's been sticking around with you for a while. These aren't really going to be necessarily the things that you think they're going to be. There's nothing that's going to be overly mind-blowing here. There's nothing that's going to be a magic bullet to fix what you're dealing with. But these are areas that people tend to really struggle with when it comes to back pain, and they are the things that tend to perpetuate back pain because everyone thinks there's going to be a magical fix to it. A lot of my job with regards to back pain is training people that they need to keep moving, that they need to realize that their body is going to do its thing to fix that given the right environment. And if we can do that, then we can get past that pain. If we can't do that, then we're really going to struggle. So that brings us to point number one. And I've got some notes here, so I'll be looking down at it. Otherwise, I'll talk forever on this stuff because I love to talk about this stuff. Whenever you experience a period of back pain, the first thing you want to do is stop, calm yourself, breathe, and realize that it's going to be okay. The number one thing that perpetuates back pain in most people is the fear of that pain, the protection of that pain, the guardian of that pain, the thought that, holy crap, I just hurt my back, now I'm going to be in trouble for a long time. If you approach it from the sense of, that tweaked a little bit, but I'll be okay, and you keep moving, not necessarily work through the pain, but you keep doing your thing and just be mindful of it, you'll be surprised how much more quickly it clears up for you. And that's something that people really tend to struggle with, is locking up, guarding it, protecting it, and going kind of into a little bit of a freak out fight or flight mode, which we'll touch on that in a little bit. And then you start to change the way that you move, and then that tends to push that back pain further and further. So step number one, calm down. It's gonna be fine. It will get better if you hurt it, and there's no reason to freak out about it. Unless you start to have issues with your bowel and bladder and your foot stops working. That's why I usually tell people, as long as you're not pooping yourself and your foot works, it's gonna be fine. Number two, keep moving. The biggest thing otherwise that I see people do aside from freak out is they stop going to the gym. They've been told or they've seen, on these lists of physicians' recommendations on Dr. Google, whatever, that you need to rest. And that used to be how people treated it. And it's not the right thing to do. You want to keep moving. You want to keep going to the gym. You want to keep walking as much as possible. Now, when we go to the gym, does that mean do the exact same thing you were already doing? Not necessarily. Do we decrease the volume that you were doing? Do we adjust the movements for what was hurting that we now need to work around? Do we adjust the loads of what you were doing? There's all kinds of things that we can adjust. Speeds, heights of your deadlift, heights of your squats, all these little adjustments that we can make to make sure that you are not irritating that pain. But the key is keep moving, keep going to the gym, keep doing your thing. Just be mindful of the things that tend to irritate your back. If that means you have to totally change up your program, change up your program, who cares? Keep going to the gym, but keep moving. Walk a lot. Go on walks, 8,000 to 10,000 steps a day. If you don't feel like you can make it to the gym to lift, go to the gym, get on the treadmill, go outside and walk if it's a nice day. That stuff goes a lot further than you would think. Number three, breathe. We talked about the nervous system. We talked about going into that fight or flight reaction. Fight or flight reaction is basically a reaction from your sympathetic nervous system, which also controls pain. It controls protection, guarding, puts you on heightened alert, and it controls pain response. If we maintain that high level of response from the sympathetic nervous system, we're more likely to maintain pain levels. So if we take a few minutes every day, lay on your back, go down to hands and knees, go into child's pose, find the position that's most comfortable for you, 5-10 minutes a day, breathe as deeply as you can into that rib cage, and exhale as much as you possibly can out of that rib cage. If we go through a few minutes of that and just train that sympathetic nervous system to chill out and let the parasympathetic nervous system take over, which can dampen pain responses, then we are much more likely to be able to get out of that pain episode quicker. So breathe, just breathe. It sounds simple, but you might notice if you have back pain, you're probably taking more shallow breaths too, because that's part of the response to it that the body's going to go through. Focus on those deep breaths. Those are the 3 big points. Because I'm extra, we're going to go over number 4. I do want to go over some movements, just a couple movements that you could try to sprinkle in just to encourage some better movement of your spine, especially if you're someone for work that sits all day, which I don't know the exact numbers, but I'd say 80% of our population is probably in that boat. Then you're probably not getting enough movement throughout the day due to that, especially focused movement of your spine. So we are going to go over a couple of those movements here. The first one kind of looks like a cat-cow, but I want you to watch how I segment it from my pelvis. And then the next one might be a little bit harder to see. I'll link both of those videos in the comments on this video so that you can go to those specifically. But both of them are going to be very, very good as far as spine health goes and getting those vertebrae moving independently of one another, getting the muscles to calm down, getting you moving in those ranges that you might be avoiding because it's been hurting. So let me move box and then we'll go over those couple. So the first one is going to be that cat-cow movement. So it's called a quadruped spinal CARS. CARS means controlled articular rotations. Basically, that just means we want to get the vertebrae moving independently of one another into flexion and extension. So that's going to start here in that cat position, and then you're going to move from your pelvis first to start dipping into extension and work your way all the way up the spine until your head and your chest are the last things to extend. And then from there, you're going to start at your pelvis again, work into flexion, and work your way up the spine nice and slow. Head and chest are the last thing to flex. Now, if I'm really in pain and it doesn't like that full movement, then I might just start with a little movement like that. Totally fine. We just continue to build on that as the spine allows me to move more, as my nervous system allows me to move more. Okay? So it doesn't have to be that full movement. It can just be small, tiny little movements that we do until it allows for that bigger movement. The next one that we're going to look at, this one's called a seated spinal CARS. This one, I'm going to sit back on my feet, and you could use some pillows under your feet and under your butt here if it's more comfortable to do that. I'm going to give myself a big hug. From there, I'm going to curl down as far as I can comfortably. I'm going to rotate my elbows out to the side as far as I can comfortably. Extend back as far as I can comfortably. Rotate around to the other side as far as I can comfortably. Point the elbows outside the knees as far as I can here. And then curl back around to the front. And then I'll reverse that. So elbows out, extend back, rotate, curl forward, back to the middle, and then relax. Okay, there's no real limit to how many of those you could do. If they feel good, do them as much as you can. Get up out of your desk, take 3 minutes here and there to work through a couple reps of each of those. But keep moving, keep breathing. Realize that it's going to be fine. Those are the top things that most of the people I work with in the office really struggle with, because there's such a big stigma when it comes to back pain and how we respond to that. So the more calm you can stay if your back's hurting, and the more you can keep moving, the better result you're generally going to have. Thanks, guys. Have a great day.